Knock, knock. Hi, my name is Susanna. I'll be your student nurse today. Can I have you confirm name and date of birth, please?
My name is Roxana Aguilera, and my date of birth is
Just check
9401.
your bracelet. Okay, perfect. And I'm just gonna go ahead and check baby's bracelet to make sure it matches, okay? Okay, great, and it does. So let me just go ahead and just wash my hands, and then I'm just gonna do a physical assessment on baby first, okay? So wash my hands. Okay, so it looks like baby is alert, calm. It looks like he's just looking around. He is awake. His eyes are open. He's just calm. He's just looking everywhere. On my initial assessment, he looks really good. I'm gonna go ahead and check his vitals, his temp. We would do under his arm, his blood pressure, his respiratory, and his pulse. I'll go ahead and assess while I go ahead and take a look at him. Okay. So let me go ahead and start off by just checking his face, checking to make sure both of his ears they're aligned with his eyes, and then it looks like his face is symmetric with his eyes, nose, and mouth. I'm gonna go ahead and assess his head. It's bald. I can feel his fundus, and I can feel the sagittal as well as the corneal line across the head, which everything looks really good, and I can feel both of his ears. Okay, I'm gonna go ahead and assess for perla. So I'm gonna go ahead and just shine some light into his eyes. Okay, good. On the other side, good. Good. So his eyes his pupils are equal, round, reactive to light, and accommodating. I'm gonna go ahead and just check his nose patency. So what I'm gonna do is just gonna go ahead and cover one of his nostrils one at a time, and then just gonna see how well he's breathing. Some babies sound a little congested around this age, and that's completely normal. And most babies are nose breathers, so we just want to make sure that he is okay and he's breathing well. Okay, I'm gonna cover one side. Okay, good. Now I'm gonna cover the other side. Good. All right. Now I'm gonna go ahead and assess some of his reflexes. I'm gonna check his moral reflex, which is just kind of like looking or just kind of simulating the side of his cheek to see if he follows it, and he does, which is great. I'm gonna test his sucking reflex as well as his palate. So I'm gonna just stick my hand inside of his mouth. Okay, good. It looks like everything is fine. It looks like his palate is intact, and it looks like his mouth is very moist, and he is sucking, which is great. But that's exactly what we want to see. Okay, so I'm gonna go ahead and assess his chest, and also actually first I'm going to assess his respiratory rate as well as his pulse. So I'm gonna go ahead and take a listen to him. Okay. Okay, respiratory rate is good and it's normal. Go ahead and assess his apex pulse, and also take a listen to his chest, listen to his heart rate and his breathing. And then while I'm there, I'm just gonna go ahead and assess his bowel sounds. Okay. Within the first couple hours after birth, bowel sounds are not present, but after a couple hours, they should be there. Okay. Okay, I'm gonna listen with the bell of my stethoscope. Listen to his pulse first. I'm gonna listen for a whole minute. Okay, good. So it looks like it's 110 to 160 beats per minute, which is completely normal. Let me just listen to his lungs and as well as his heart rate and his heart. Okay, now I didn't hear any murmurs, and his breath sounds sound equal bilaterally, so it's all very good. Let me just go ahead and listen to his bowel sounds. So I'm gonna start at right lower, right upper, left upper, and left lower. Good. Everything looks really good. Okay, has he had a bowel movement today?
Yes, he did.
Okay, what color was his bowel movement?
It was black.
It was black, okay. So that's completely normal for the first days after birth. Then it usually turns into like a seedy color, depending on how we want to feed him, if we're going to breastfeed him or formula feed him. It might change, his bowel movements color might change a little bit, but usually black is normal. It's called meconium. So I'm gonna go ahead and just assess. And what about his urine? How often is he urinating throughout?
About every hour.
Every hour? What color is it? The normal color?
Yeah, it's just normal.
Okay, good. Good. Okay, everything looks really good. Let me just check his reflexes. So I'm gonna check his plantar reflexes first. So his feet just have to curl just around my finger right here. Good. And they do. Let me check his Babinski, which is when I just tickle essentially his foot, his feet should just like curl. Good. Let me go ahead and count. There should be 10 toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Good. That's perfect. Let me assess his plantar reflex, or his palmar reflex. And it should be just the same thing, just putting my finger right here to make sure that he is able to put his hands around my finger, which is great. Let me count how many fingers he has. 1, 2, 3, 4, 5. Good. 1, 2, 3, 4, 5. That's very good. All right. And then I'm gonna go ahead and just assess his neck, just to make sure that it all looks very good. Excuse me. His color looks really good. He's pink. It looks like his skin is thin, but it's all within normal limits. That's what we're looking for. And then I'm gonna go ahead and assess his umbilical cord, and it looks like it is it's dry. It's still there, still present, and it is yellow, so that's very good. That means that it's getting ready to fall off. Okay, so we should see that in the next couple weeks. Okay, let me assess his diaper area. So if it's a boy, we will be assessing his penis to make sure that we see an opening of where the urine's gonna come out, where it should be right in the center. And then we're gonna feel to make sure that we feel both of his testicles to see if they're descended. Okay, and they feel like little marbles, so that's very good. And then if it's a girl, we would just assess to make sure that the labia is covering the clitoris and then if we see any vaginal discharge, it's completely normal. Sometimes it might kind of look like as if she's having a period, and that's normal within the first couple days after birth. Okay. And then we're gonna assess to make sure that the anus is present, and it looks like it is. The opening is there. Okay, and then let me just make sure, just assess his spine. Okay, and it is normal. It is midline, and there is no openings. I don't see anything out of the ordinary, which is very good. All right, baby looks really good. He looks. Do you have any questions? Any concerns about him?
No.
Okay, so I'm just gonna go ahead and wrap him back up. And he looks very good. There you go. Thank you. So I'm just gonna go ahead and wash my hands now, and then I'm gonna document my assessment. And if you have, here's a call bell, and if you have any other questions, give me a call. Okay.
Alrighty, thank you.
See.